All right. My name's Dustin Anderson. I'm here for my end of semester reflection and action plan for AATTR 755 Clinical Experience 1. Um, our first little section is reflect on our performance and about our SMART goals and our clinical plan for continued development, education, and so forth that we set at the beginning of the semester. I like to talk a little bit about some of my SMART goals. My first SMART goal was to make sure that I stay on top of my reading, stay on top of the reading required for the semester. I feel like I did a fairly decent job of this, but it could have been better, especially midway through the semester. Just hit a burnout block and sort of lost focus, and it took about 2.5 weeks to get that focus redirected back to it. I will say, with manual therapy, it took a bit to get re-engaged with that class, especially with the readings, because there wasn't much direction at the beginning through the teacher of what we were supposed to read and what we were supposed to get from it. But communicate with the teacher, then finally got back on it. It wasn't so much readings as far with research that I had a problem with. It was with the videos. Just staying on top, watching all the videos about the different research methods and everything else. I found myself sometimes playing catch up with that, and it was okay. Like, I like the videos and everything else, but I don't know what it was. I think with reading, I thought it was more tangible, more pertinent. I know that's bad to sound because the videos were great, but I was like, oh, it's a video. I can watch it anytime I want to. Not really thinking, hey, you it's not only watching it. You gotta listen. You gotta write it down, and you gotta reflect on it. It took probably 2 or 3 weeks for me to get that through my thick head, to be honest. But after that, it was fine. Um, my second SMART goal was to make sure that I was writing quality responses to blogs and threads in a timely manner. We didn't have that many of those this semester, which I loved. I like the collaborative sessions, and I think I added a lot to the group discussions with that. I really think that helps me connect with the students being at a distant site, being in Georgia and everybody else is in Indiana, in Terre Haute. I really like that. I'm more of a talker than a typer. As you can tell, Dr. Games, from the things that I sent you. Spelling and grammar is not my strong suit, but I can talk about subjects for days. I feel like, especially if it's a good, engaged discussion, and I feel like I can help move the discussions along. And I really, really like that part about the clinical class, was actually talking to my students, just not typing the response, because you don't know what the tone of their voice is, the inflection, or anything else. And I think with the talks, I really got to the meat and potatoes of what they were going to say. Now, moving on to my professional development plan, I had my goals were to put proms into clinical practice, work on leadership, mentoring, and athletic training, education, development. Proms, I did not do a good job with. Um, it was there's a lot of there was, I thought I knew the challenges of putting proms in the military till I actually tried to start doing it, then failed horribly at it. Um, I I guess I think I could have. There's no guess. I could have tried harder at it, but it was just I had so many other things to do, and it's an excuse that it didn't get done, but it was the excuse that I used this semester. Um, Looking back on it, there's got to be a way. I just got to figure out that way. I think I need to talk to Dr. Sefton a little bit more, maybe coworkers. Um, we've had one or two discussions about it, about putting proms into the military setting, and the difficulties that we face with that one. Um, and I didn't get my paper for the MTSS risk factors in the military population done. Um, Everybody at Indiana State did their part, but I fell short on my end. It, when it got to me, when everything got back, it was the time that I was really hitting burnout, and I was just like, oh God, this is one other thing that I have to do, and it just sort of made me sick to my stomach, and I just shut down totally on the project, which is bad to say, but it happened, and I know why it happened, and I guess I guess that's something some people don't even realize why it happened. I would like to re-engage that. Hopefully, over break, I can look at it and get a little more involved with that assignment because I think it is good with what I was doing, and I really want to get it out there, but it just hit at a wrong time with me. And I kept presenting military LPDs, and they sort of died down at this time of the year, but the military is getting ready to go on holiday block leave in December, so there's not as many people there, not as many opportunities to do that. Um, and let's see. I went to for continuing education and clinical practice. I went to a great seminar by Kevin Wilk in Atlanta. It was the shoulder and knee course, what they don't teach you in school. I really enjoyed it. Um, Kevin didn't try to reinvent the wheel. I learned good things that I could take straight to clinical practice. I'm going to try to say this word. If I slaughter it, I'm sorry. Perturbation. I really never really seen that done as far as for proprioception, neuromuscular education when it comes to rehab, and it was really awesome to see how he did that with shoulder rehab and knee rehab, and sort of get his take on scapular dyskinesis, the biceps tendon as a pain initiator in the shoulder. So if they're having anterior shoulder pain, the biceps just may be irritated, and we got to get that calmed down before we really figure out what's going on. And learned a lot of great stuff with the knee rehab, and he brought 25 plus years of physical therapy experience. I sort of felt like the little kid on the island because I think I was only like one of three athletic trainers in a room full of 80, but I think that was good for me to go there and be in that situation where I'm just with physical therapists and everything else. We've talked a lot about interprofessional practice. Force myself to talk to PTs. I know sometimes there's this war going on between athletic trainers and physical therapists, but um, just tried to become engaged with that population and sort of tell them what I do and what I can do. As far as leadership and mentorship, I think I've done a really good job with the new employee that come in, Jordan. Just been helping him along the way, getting him used to the military setting, answering any questions that he has, trying to get him to develop personal goals and everything else, and what he wants to do with the program. I think with leadership, I've done a pretty good job. In some of my classes, I've taken a step back and let other people take charge, and not being such a control freak with those. And I think the sign of a good leader is they know when to follow and they know when to lead. So I may not be the lead on the assignment, but I'm sort of giving it a push to make sure it gets done. Then sometimes I'll take the lead if it needs to be, but just doing that I think's been really well. Oh yeah, and another thing that I did for increasing my clinical knowledge, I got my USAW Level 1 certification for Olympic lifting. I teach a lot of Olympic classes. MCCC calls them Olympic lifting classes, but it's just mostly deadlifts and power cleans. But going through that certification, I feel better prepared to teach those classes, so that I'm teaching the right technique and people are getting some benefit out of it as far as injury prevention goes and sports performance. For next semester, I want to do a better job of staying engaged with my classes because, like I said before, that was about a 2.5 to 3 week stint where I became disengaged, and it took a while for me to talk to you about it, Dr. Games, and I think when I going through that, I feel better about picking up on it, and I want to be better at seeking help for me, if that makes sense. When I feel like I'm struggling or anything else, I want to be able to ask for help. I know it may sound like a wonky clinical goal, but I think it takes a team to come through to do an evaluation, but also it takes a team to keep your sanity too, with everything. I want to do better about keeping up on my videos and my week to week work. I feel like with the week to week work, let me rephrase it, not the week to week work, the long term goals. I need to make sure that I'm checking those boxes at least once a week, and stay on top of those, because I don't want to say they're easy to forget about, but they're just easy to get lost in the wash with everything. And that's come back to bite me in the butt a couple of times, especially with the long term assignments. So I want to do better about staying up on the long term assignments. I want to find someone in Columbus or Auburn that can help me with public speaking, because looking back on the presentations that I had, I got I think a 3 on my delivery. I think I have good information to say, but I just need to work on my ability to convey that to the audience. Sometimes I feel like I just got this white nerdy like Ben Stein voice up there. And seeing you and Dr. Eberman talk and the presenters that we had, it's definitely an art form. There's definitely something to it, and I think with practice it would be better. But I think I need to find someone to help me with it, to help develop that ability. Because if we're going to move forward as professionals with the DAT, we got to be able to stand in front of a group of people and honestly not sound like dumbasses. Not saying that we sound like dumbasses, but we just don't fumble over everything, that we present it well, we present it clear, sharply, we keep them engaged with everything that we're talking about. And I want to get to that level. I know that I have a lot of work. I think I'm good, but I don't want to be good. I want to be great. So if I had to put it on a 5-point scale, I think I'm at 2.5 of public speaking, and I want a 5. Like, I feel like I'm halfway there. I've got more comfortable, but I want to get higher up there. And if there's any suggestions that you would have, that would be great. And I just want to keep this good life work balance. I've finally figured it out, and I want to continue that. And I want to, when the new DAT students come in the summer, I want to help them. And if there's any of the DA students that that have problems with that, feel free to have them call me. I feel like I've got a good plan, and I do it fairly well as far as work and life balance, and I want to keep that up. As far as clinical practice, next semester is going to be big. We're going to be moving to 4 different bases. Who I'm working for, I don't know, but I want to continue to push athletic training in a positive direction in the military, and I want to keep up that scholarship as far as educating my patients, treating my patients well. Do better about trying to get proms into clinical practice with the military. So some of the goals are the same that I thought were going to be easy to do as far as proms, but I think it's the ones that you think are easy that wind up being the hardest, because you don't work at them that hard, because you're like, oh, it's going to be easy to do, it's not going to take much effort. Then you try to do it, and the logistics of it sort of bog you down. I think I have a better grasp on what I may need to do, and we'll see. It may be that this semester I fall flat on my face again, but Edison didn't get the light bulb to work the first 2 times. So I just want to keep plugging away at that, and hopefully add proms to clinical practice, and you go from there. And I look forward to next semester, and thanks for all the help this semester.